When I sit down to talk to a patient about what's going on in their mouth and what options for treatment are, I really try to personalize that and tailor it to that patient, because I want that patient to understand what their condition is in all facets, and then what the solutions can be, because that choice is really up to them. I'm not making that choice for them. But I realize if I don't present all of the options, then I am making that choice for them. So I take that completely off the table, and I just present the facts of, hey, this is where you're at, this is what's going on, this is the way we can treat this. So when I have a patient in my chair, the first thing and the most important thing to me is to really spend time looking at their medical history and understanding what is going on with them as a whole. Because when I look in their mouths, I know that what's going on in their bodies is going to correlate to that. So say I have a patient who has, this is a new patient coming into the office, and they're diabetic, and they've had a couple of rounds of scaling and root plane over the last 5 years. When I go to Perio chart that patient, because I don't know what that patient does and doesn't know about periodontal disease, even though they've had scaling and root planing in the past. I've had multiple patients tell me, yeah, I had that deep cleaning, but I don't really know why. And that blows my mind, because I feel like that patient should know what's going on. That's important. So when that diabetic patient's sitting in my chair, I say, I'm going to go ahead and check the health of your gum and bone, and I'm going to take some measurements around the gum line. I call out those readings so they can really see what's going on and understand what's happening there. So I say, anything 1 to 3, that's normal and healthy. Anything 4 or 5 or above, or any areas of bleeding indicate some inflammation and infection. And then I call out those numbers, so that by the time a patient hears me call out those readings, they understand, okay, there's something going on here. And I sit them up, and I take off my glasses and my mask, and we have a conversation just eye to eye. And I explain to them what those numbers really mean. So I say, anything 1 to 3, that's normal, that's healthy, that's what we want to see. But you heard me call out some 4s, and those are typically indicative of bacteria that have made camp up under your gum line and have started to secrete toxins. And those toxins have irritated the tissue so that they're puffy and swollen, and they've given me a little bit deeper reading. You heard me talk about some bleeding too. But where you heard me say 5 or 6 or 7, that's where those same toxins have started to dissolve the bone under your gum. And that's what we call periodontal disease. That's what you've got going on. Well, obviously that concerns me from a dental perspective, because your bone is your foundation. And if we've lost bone, we're starting to lose that foundation. If you lose enough bone, you can lose teeth. And obviously it's our goal to help you keep your teeth for your lifetime. But what concerns me more than that is what happens systemically. So anytime you have bleeding in your mouth, anytime you chew food and it's pressing down on those gums, you're releasing those bacteria and those toxins into your body. You are diabetic. Anytime you have infection in your body, it increases your body says, whoa, we got a problem, and it increases your blood sugar so that it can fight off that infection. And increased blood sugar for you is a bad deal. So you've got this infection that's feeding your diabetes and vice versa, and that is not healthy for you. So obviously I want to help decrease what's going on with this infection in your mouth so that you're not pouring that blood sugar out, and that you can get yourself healthy and your numbers healthy for the diabetes. And then I talk about, how can we treat this? You've had scaling and root planing multiple times. Clearly it hasn't really solved your problem. I feel like I have a solution that's going to be a whole lot easier than the scaling and root planing you've done in the past. And it's not only going to get you healthy now, but if you'll be compliant and you'll stick with me, it's going to keep you healthy long term. And I would be willing to bet that your A1C numbers are going to improve over time as we treat your infection. So you see, I really try and tailor each patient's individual, issues and concerns when I talk about the treatment options. And when you do that, it makes it really hard for a patient to go, no, I don't want to do that. I just want to do that same old scaling and root planing that I've always done that didn't work. It's really educating them and showing in a true light what's going on so that they can make that educated decision. Now, do I have some patients that sometimes still say, well, my insurance doesn't cover those trays, so I really just want to do that for now? Yeah, I do. And I do what they want to do because it's their choice and it's their treatment. But I will tell you that I've had multiple patients that have done that route, and a year later they're still with me, and they come back and they go, yeah, it's not any better. Okay, let's do those trays now. So there's encouragement that they may not make that choice today, But there are a lot of patients that make that choice down the road. Dentistry is a huge trust factor. A lot of patients come in and they don't trust you yet. They don't know you. They don't know dentistry. And so I believe that if you're authentic with them, you truly care about them, you're giving them the option and letting them make the choice, then I think that builds that trust, and they do finally come around and go, all right, let's try that thing you mentioned.